today's meeting, and we have a meeting which is, I think, a very interesting one, very much focused on a single report, but an extremely important issue, which is the learning coming out of the experience of the pandemic. And we'll be on to that one very, very soon. But we'll start with the apologies for absence. I think we had a single apology for absence, and Anne Webb, who I'm very glad to say that Councillor Murphy has been able to step in for. And we've just heard also that Councillor Fuchs is unable to make today's meeting as well. So we have those apologies, and I think that's all, Robert, at this stage.
With the exception of Councillor Wright trying not to.
Yep, I'm aware that Councillor Wright is planning on joining the meeting. She's just having difficulty with her laptop, so I'm assuming that she'll be able to join. But we will crack on. So declarations of interest, if there are any. I don't see any, and we'll move on to the public open forum. Robert, are there any issues from the public?
No one in attendance today, Chair.
Okay, thank you, Robert. And we'll therefore be able to move straight into the main item of the meeting, which is the COVID learning and pandemic preparedness. And that particular title is really at the heart of why we were, as a committee, extremely interested to have this report, because it's the intention behind the request was really to help us as a council and as a county prepare for what none of us want, but scientific experts and leading public health experts advise is very likely to be coming, and that is another pandemic. I feel like, at the Ides of March, and how appropriate that we're well into March to be saying these things. I don't want to be at all problematic about this, but the reality appears to be that is going to come at some stage, another pandemic. So how would Monmouthshire and how would Monmouthshire County Council behave differently, do things in a way that we could say we would do it better, and learn from those areas that did work really well and do them again? What would we do? How would we behave differently? So that is why this is very much called COVID learning and pandemic preparedness. And we're pleased to see that we've got a number of key officers here. I'll ask you, as you speak or respond, if you could possibly introduce yourself to those who might be watching online. But we have Dave Jones, Louise Driscoll, Alan Thomas and Sam Watkins with us. So thank you for being here. And also Councillor Griffiths, who I'm pleased to say as Cabinet Member has joined us. And I'll start, if I may, by asking Councillor Griffiths if you have a few words you might want to introduce the report to before perhaps handing across to Dave, and then questions. Thank you.
Thanks very much, Chair. As a Cabinet Member, I very much commend the Scrutiny Committee for initiating this review, the review of the COVID experience, which we all lived through, which we'll never forget. But more important, building on that review to look at future preparedness. I think it's a very timely and important review that you're undertaking. For myself, I was not part of Monmouthshire County Council during the pandemic, that period 2020 to 22. I was not an elected member of the council, and for much of that period I was not even living in Monmouthshire. So your scrutiny is going to focus very much on the officers who were here, who saw the county through that period, and I will listen as interested as you are in what they have to share with us. There are members of the Scrutiny Committee themselves, one like me, were on the council at that time, Councillor Murphy, Councillor Pavia on screen, and I'd be very much interested in their reflections as well. I'm sure we can learn from that. By coincidence, I was, during that pandemic period, an advisor, special advisor to the Welsh Government, local government minister, attending very often meetings twice a week with 22 local authorities, attending cabinet meetings very often twice a week, meetings with UK ministers. What I learned during that experience was that the local authority is very much part of a network of relationships as it did and will in the future seek to control communicable disease. That network includes the UK government, the Welsh Government with devolved responsibilities, Public Health Wales, the Health Board, the local authority. There's a document in your report, linked in your report, where the Welsh Government has looked to the future and has mapped out those relationships. The local authority ourselves may appear to be at the bottom of a hierarchy. In truth, I would like to reverse that picture and say that we're not at the bottom. We are the foundation stone of that set of relationships, and we're the foundation stone because very often we are the link between those organisations and the public themselves. And we will only control communicable disease through a partnership with the public. And it seems to me that the local authority needs to be recognised as crucial in creating and sustaining that partnership. During the pandemic, my single reflection that I'll share with you was that through the relationships that we built up between Welsh Government ministers, directly with 22 local authority leaders, we built up a relationship of trust, sharing responsibility to the extent that when you look, and you will do in your discussions, at the whole track and trace responsibility, we kept that responsibility with local authorities, whereas in other parts of the UK that became a centralised and in part privatised endeavour. I think we were right to put the local authority in that role, sustain it in that role, and we can learn from that going forward. That's my reflection, but I'm far more interested in the reflections of our officers and yourselves as committee members. Thank you.
Thank you, Councillor Griffiths, and it's good to have a different perspective that you've offered there, so thank you. I'm going to hand over to David Jones, who is the Head of Public Protection, and beside David is Louise Driscoll, the Specialist Environment Health Officer. Dave, do you want to pick up the threads of this and key points from the report, and then we'll open it to questions, please?
Excuse me, Chair. Excuse me, Chair.
Certainly, sorry, Councillor Bond.
What's co-pilot, please? And can someone explain why it's been transcribed, this meeting? Thank you.
Robert, do you want to just respond?
Yeah, it's just the software that transcribes the meeting. YouTube transcribes it as well. It's just a superior transcription, just as a secondary record of the meeting, just for future reference.
Sorry, Chair. Is this normal?
Yeah, it's used across all of the meetings now. We've been using it for several months.
Thank you, Chair.
Okay, thank you. And David, over to you.
Thank you, Chair, and thank you, Councillor Griffiths, for that introduction. We'll go through a report shortly. My name is David Jones. I'm Head of Public Protection. I'll introduce the officers with me, so it'll be a shared response, depending on what the questions are. So to my left, I'll introduce people. Maybe introduce yourself.
Hi, I'm Louise Driscoll. I'm the communicable disease lead currently, but I was the TTP lead, one of the TTP leads during the pandemic.
Al?
Good morning, Bwreda. Alan Thomas, Environmental Health Officer, working with the team through the pandemic, and I was leading for a part of it on communication with care homes.
Hi, good morning. It's Sam Watkins. I'm an Environmental Health Officer at Monmouthshire, and through COVID, I was one of the TTP leads.
Okay, thank you for that. So as I say, it'll be hopefully a combined effort. Yes, in terms of the purpose of the report, it is about our track and trace. How do we set that up? As the chair says, we'll try and focus on state of readiness going forward. So there will be I think we obviously do need to reflect on the look back, and then clearly members will be keen on the look forward. So we'll try and cover both aspects. I'll talk through the main aspects of the current report. I think members will be keen I don't go through each of the appendices in turn. Appendix 1 was all the lockdown restrictions that came our way, alert levels, etc. So we'll touch upon that, but basically we're taking obviously that members have looked through the paper that's been provided. So as I say, I'll focus on the current report, which is a summary of what you find behind the covering paper. So yes, in terms of the recommendations, it's to obviously scrutinise our involvement and what we'd look to do differently. It is very connected, as Councillor Griffiths commented on the national, regional connections, and clearly then locally as well. We were the conduit, if you like, between every department in Monmouthshire, workplaces, etc. So it was quite a concerted effort, which we'll see as we talk through the report. Just to make the point 2.2, it is about reducing person-to-person spread. The responsibility of that rests with the Nairn Bevan. So we were pitched in, because of our expertise in infectious disease investigations, normally we deal with salmonellas and shigellas and legionellas, that sort of stuff. So it tends to be food to person, water to person. So person to person is the responsibility of the health board, but we were drafted, as I say, because we had expertise in dealing with that track and trace element, which is known to be a way of reducing community spread. So just to be clear, that's the sort of scope, if you like. If there are questions that are more aligned to health boards or public health wells, then clearly we could take those away. We're not virologists, we're not epidemiologists, but we know people that do that part of the work. So measles, for example, we don't get involved with that. That's a health board function, just to be clear from the outset. So in terms of the key issues, reason it's here we know, that came on the back of the performance report last June. 3.2, I think Councillor Griffiths has picked this up really in terms of that, linkage to national requirements, etc. Not to forget, though we've got some environmental health officers with us today, not forgetting colleagues in licensing and training standards. They too had to work through that compliance. I know the focus, I think, is going to be on track and trace. But clearly, it's about behavioural change as well to make sure compliance in businesses, etc. So that was key to providing an effective service. Listed a few examples there: the social distancing, outdoor event requirements. That was a task in itself. Bubbles in schools, screening outdoor spaces for the licensed trades, payment licences, protection of taxi users, people that are going essential workers to Neville Hall from Abergurney train station. There's a lot of detail that we had to unpick and communicate to folks. What I would say, the bottom of 3.2, I think that was absolutely key, was working within different departments of the council. Social care, obviously got Jane, Chief Officer Social Care and Health. Commissioning teams, where we had issues in particular care homes, that was absolutely key to connect that to the actual service directly. Education, I think we had a direct line to Will McLean and head teachers in terms of controlling spread within educational settings. Communications, emergency planning, communities in place. So highways, depots would have cases of COVID. People are travelling cars together potentially. So we have the same remits for those staff within the authority as those outside. Training SRS, is a big task, setting up such a big team in a short space of time. Councillor Griffiths mentioned obviously an Nairn Bevan Health Boards. Gwent Police often get overlooked. We did work closely with them in terms of compliance. So we did have issues where someone's not complying. We didn't mind contacting the police to do some door knocking, and they were very out and out being proactive. I have provided some links there, as referred to, rather than talk about the merits of track and trace. I think it's better to just link you to national documents on that, so the focus will be how we set things up. So Appendix 2 is very much the linkage between national to regional. So I was on the regional groups to make sure that it was translated effectively to the front line. So that was very much an evolving emergency legislation. So we had to keep track of that and obviously make it clear to those that needed to comply with regulations as to what they needed to do. Appendix 3 then, I think probably councillors would be interested in the local setup, and that's outlined in Appendix 3 as described there. Bit difficult really to sort of verbalise how tricky that was in terms of the early days. We had to set up an 84-hour-a-week operation. So most council services are 37 hours a week, so just stepping that up was quite a thing. 7 days a week, 8 in the morning till 8 at night, and that was obviously to control that spread via contact tracing. What does that mean? We can touch upon that if wanted, but that's about establishing the routes of transmission, determining who those close contacts were, notified cases, ensuring self-isolation, building trust for those called. Obviously, sometimes they weren't actually complying. They'd been out and about, perhaps when the travel restrictions in place. So we had to build up that rapport and trust with members of the public and local businesses, etc. Rapid response was the key thing in terms of getting to understand where transmission routes were to ensure that that was quelled as best we could. Again, Councillor Griffiths has reflected on very different to the England model, so that was much more of a call centre type system for track and trace. We put our environmental health officers front and centre of that, so they could obviously link that directly to the investigation work that needed to happen directly after notifications. So there's a rapid response from being notified of a COVID case to contact to restrict that community spread, be it through a workplace, health setting, etc. Appendix 3, as I say, is probably what members would be more interested in terms of how we actually manage those cases that fluctuated depending on alert levels and the vaccination programme. Clearly that had a big impact. 3.7 I think is important. You know, that's our go-to document, is how we control communicable disease. There's an outbreak control plan for Wales. There's the link there. So that was updated as a direct consequence of the COVID pandemic. There's an exercise this afternoon that takes my colleagues away to actually work through, does that work? So it's always important when we produce documents, co-produced with our health colleagues, that do they work? So there's an exercise this afternoon that will test that system. So that's some EHOs plus emergency planning involved with that. Lessons learned, as the Chair says, I know that's what the primary focus of this morning. The positives, so I've summarised them and I've just sort of lifted that really from the appendices. So rapid response, how to get that done and up and running quickly, so we did that very, very effectively. The flexible workforce needs to be emphasised. That was a combination of permanent EH staff. So we take some from Hugh's team. You recall Hugh, who deals with the more domestic issues, noise complaints, etc. We got them onto the track and trace system to deal with that, and we just dealt with the emergencies on the other side of environmental health. We redeployed staff from other departments, for example, internal audit, Monlife, particularly if leisure centres are closed down, community hubs. So some of these staff are absolutely excellent in terms of track and trace. And that was very flexible. So obviously there's peaks in demand. Winters tended to peak, so we had a flexible workforce to allow to deal with those fluctuations. I mentioned licensing and training standards, then clearly they were involved with trying to reduce that spread, be it through households, workplaces, or whilst out and about in the community. So we had fast determinations of source and spread to ensure that onward spread was limited. Backward tracing is an art in itself, but I'll leave that for later. A colleague to talk through that, what we mean by that. Co-production was a positive. All sorts of jargon came out, SOPs and SCGs and all the rest of it, but one of the ones was standard operating procedures. So it's important when they were drafted, we'd have regard to what they looked like and would they work on the front line because of our liaison with care homes, etc. Data recording, we were congratulated for this, was, off our own initiative, was a coloured system, so very much Louise and Sam were dealing with this to actually connect cases together so we could understand where the clusters were. Is it a household transmission? Is it someone who's gone off to Bristol to notify that workplace you've got COVID cases that are stemming from your business? So data quality is really something we did off our own bat, and that worked really well. As I said earlier, I think that source of environmental health expertise front and centre, I think, really proved to be beneficial. And it's also to decipher Appendix 1 was something in itself. So that was welcomed by our colleagues across the council, be it social care, education, highways, all sorts of different departments would come to us to navigate their way through the changes that happened on a regular basis. Network with English colleagues, it's in the appendices, and usually perhaps we do border 6 different authorities. So we have regard to the West and Powys, but then if you look to the East, we have to liaise closely with Herefordshire and the Forest of Dean in terms of making sure that these cases were dealt with promptly, because obviously the rules in England were slightly different to the ones in Wales, and often the timelines were different. So that was an issue that we worked through. But that did work well. We had regular contact with the Bristols and the Public Health England and other colleagues the other side of the border. Regional working, I think that's been mentioned. I think hopefully that comes through the appendices has been very effective. And going forward, those connections are really healthy now, going past the pandemic. Those establishments, those liaisons with the testing centre, colleagues in Narren Bevan, etc., are now firmly established should we have another event of a similar magnitude. So that's some examples of the positivity in terms of going at what we did in the past, and I think the learning from that obviously hugely assists us, so we're not starting from a blank piece of paper. We've got contacts in terms of ICT, we've got contacts in terms of people that can actually do that track and trace if that needs to be stepped up again. And also the learning for us is to keep environmental health front and centre of that, because they've got that infectious control expertise, so that worked really well, which wasn't necessarily the case perhaps in England. So we think that's really helpful. So that's the positives. Negatives, obviously on the flip side of some of that, an 84-hour-a-week system does put extreme pressure on certain individuals. A couple of them sat here today. The hours were pretty extraordinary. So I think we'd have to work that through better in terms of how we set it up and ensure that's manned in a responsible way to ensure people's work-life balance isn't compromised excessively. Worth noting the numbers, isn't it? If you had up to 87 staff dealing with track and trace, the entire staff of public protection is 50, so it shows you that we did really need to work closely with HR, ICT to get these things dealt with and resolved quickly. Being the go-to experts in internal departments, it really was pretty full on in terms of calls from education, calls from commissioning, calls from highways, etc. That did cause a pressure point in terms of being, that's the flip side almost, isn't it? Environmental health being the experts, because they're limited in numbers, we did have a particular strain on a limited number of officers. The changes to national rules tended to happen on Friday. We did feed this back to the public inquiry. Then obviously we get inundated with calls then from business, schools, etc., because it's either imminent or it's going to happen on Monday. So that was a tricky situation we had to navigate our way through. And clearly the differences between Welsh and English restrictions. So you can have an event organiser, it's legal and you can do it in England, but if he comes 10 miles into Wales, he couldn't do that. So we had some tricky conversations, but we didn't mind that. Some hard conversations with some people to say you can't do X, Y, and Z because the restrictions don't allow you to do that. But I summarise that to say we think the positives did far outweigh those negative aspects, and there's a solid platform to work from should we be asked to provide our professional assistance again in the future. Again, I put a link in there, so Audit Wales have talked through the benefits of track and trace and some of their observations, even though it's only 1 year into the pandemic. That's a useful source of information as well. 310 talks about, obviously, let's not forget the civil contingency aspects. They were fully engaged with that, so the local resilience forum sort of summarised in Appendix 2, and as I said earlier, I think key is testing these plans, and that key document is being tested this afternoon, so that's really positive. Finally, I'm almost finished now, Chair. Then the lessons learned is key. The UK public inquiry rolls on, as we know. That will take some time yet. It's finished in Wales now, but I think importantly, the lessons learned section will be shared by the end of this year, I understand. So we're not waiting for the completeness of the public inquiry, which is some way off. The lessons learned elements will, I am told, will be published later this year, and obviously we'll welcome sight of that so we can focus on those lessons learned across the UK, not just the picture in Wales. Integrated impact assessment, because there's no decision there, Chair, but just to make the point, we did follow those principles in terms of targeting our more vulnerable members of society rightly, because they were more at risk. A lot of work done regionally on BAMEs, as we call them, so the black and ethnic minority groups. MOS were targeted in terms of behaviours, etc., to get them engaged, to make sure they did isolate, etc., to prevent spread within their groups. The reasons just link back to the recommendations. That's the reason that we're here today, is to explore our response, and specifically noting that members are interested in the lessons learned. Hopefully, the appendices pick up that issue as to how we set up in partnership with our health colleagues. I think that was an effective use of resources across the piece. The resources, it was fully funded by Welsh Government as an emergency position. Even though I wasn't going to talk about the appendices, Chair, just to very quickly flag up, case numbers. I think, they were significant, so I just very quickly don't expect members to go to the documents, but Appendix 3.9 refers to case numbers. I just remember these are daily numbers, but I just think it's useful to think, actually, if you look at the Monmouthshire numbers compared to the Gwent numbers, they tend to be, generally on average, about 10% of the total. That's a lot less than the actual percentage of Monmouthshire citizens in the Gwent region. It's 16% as a percentage, so typically we're far below that. You could say stroke of luck, good for you, but I like to think it's very effective track and trace, a very speedy response. And also those communication channels, not just through MCC with Health Board, etc., ensured good compliance. So I think it's about good compliance in the community in terms of use of face masks, social distancing, etc. Being quick where troubles arose in terms of compliance, working with our colleagues in Gwent Police. But I think if you look at any figures, they're generally, as I say, a lot less than the 16% you would note if it was just done on a population basis, which hopefully is a reflection on the staff. And then just the last one, I promise, is the blue graph in Appendix 3. It's just interesting that I mentioned the ebbs and flows in terms of case numbers. So Omicron was emphasised there in the Christmas of 2021, going into January 2022. And then if you see the next peak, that's because the restrictions are lifted. So you can obviously track when the alert levels raised and lowered. So the second peak there in the picture, just for information, is where the alert levels drop to 0. Give it a few weeks and the case numbers go up. But clearly by that period, the consequences are a lot less because the vaccination system is working very effectively. And so when people did have COVID, the symptoms were a lot less than they had been in 2020. So I think, Chair, hopefully that's covered it, and we welcome questions. Thank you.
Thank you, David. And that's it certainly picked out some key points. I would, just before we move to questions, we have a number of hands already raised. It's previously been said how positively both the council and communities responded to the pandemic and the crisis that brought to us so quickly. And in many ways, it was completely exceptional, the way that people responded. And I'm sure that members of this committee and right across the authority are eternally grateful. And I don't want to miss the opportunity to just express that whilst we're actually looking back on this. Absolutely eternally grateful to members of the community, but also those fantastic people involved in the third sector who stepped into this extraordinary need for help, and they did so much to help, alongside the extraordinarily hardworking officers and employees of the council. And they put themselves in harm's way very often, and they knew they were doing so. So it was the most remarkable effort, and one I'm sure in history of Monmouthshire will have its own special chapter. And of course, you know, our fantastic partners, they are very much blended into this report. They are absolutely incredibly important partners: the NHS, the police, the ambulance services, fire and rescue, and others that we owe an enormous debt of gratitude to. And I just want to put that in the record for the importance of the work that they did in so many different ways. You mentioned in Appendix 2, I think it is, the LRF, and it's just to spell that out for there's residents may be wondering quite what that is, you know, the Local Resilience Forum. And I think it's really important that residents of Monmouthshire do understand that we have an ongoing Local Resilience Forum, the meeting of those many different seriously key partners within our county to ensure that the county is kept safe. And that is not simply about a pandemic, but for any particular development that may bring about risk of one kind or another. And that is ongoing. So, you know, this didn't happen out of thin air from the point of view of being organised, but there was an awful lot of very rapid thinking that needed to be done to apply what we all did as partners to this new crisis when it emerged. I just wanted to put those kind of footnotes in there before we move into questions. And I'll start with Councillor Bond. You had your hand up first, I think.
Thank you, Chair, and thank you very much for this report. And I'd like to echo what Chair has just said. We'd like to, well, you should all be applauded, everybody involved, and we really appreciate the amazing work that was done and the pressure you were all under. It must have been very exhausting. So well done, everybody, for the work that you did. Fantastic. So I can see that this is very much from the environmental health perspective, and of course that is the crucial high level, or what we really needed was vital at the time. What we also asked for as a committee was a review of what happened to the rest of the staff. You know, what happened when the staff were taken away for test and trace, and how everybody managed the work from home, how people coped with that, and really the impact of the pandemic on the council, and what we did in the finer detail, you know, in the groups of the council. So really, I actually sent a format, a tool for before action review and after action review, which I was told would be complete. I don't know, well, is that going to be following? That's one question. So really, what happened in the council, how it was able to cope with everybody going off to the quite vitally the test, trace and track, trace and protect. Sorry. So an impact on everybody else. Are we going to have another report that actually gets into the nitty-gritty, how things were changed, how people were affected, the impact, and what we're going to do differently? I understand you've said that there's a laptop, an exercise today that will actually test your plan, so you've got a plan for the future. That is fantastic, but it's only at that level in that environmental health, which is vital, of course. But what about the rest of the authority? And I don't quite agree about the IIA. I think an IIA is really important because it needs to be put down somewhere, or written down somewhere, what you did, how you put but I think you meant forefront in 4.2, how you thought about the ethnic minorities, the older people, the more vulnerable people. So if it's not written down anywhere, then it's like it could be forgotten. So I disagree. I think IIA is really important. And so So the point is, this is a specific area versus the COVID, the high level, as it were. Please, can we have a further review of what actually happened and how, for example, I was on the town council. I know it's a long question. I'm sorry, I'll shut up now in a second. I was on the town council. We had so much help from MCC to get DBS checks to help us set up so that we could go out and shop for the vulnerable, do the prescriptions, everything. Fantastic work, and I hope another report is coming. Is that right, Councillor Griffiths, please?
Thank you, Councillor Bond. You covered quite a lot of ground there, I have to say, and I think we'll need to try and home in on a couple of specifics. But for any residents looking and wondering what IIAs are, they're the Integrated Impact Assessments, which are extremely important to understand just the way in which policies might have an impact on groups within our society. So just to explain that, could I ask, and it might be Dave, it might be Louise, Alan, or Sam, or indeed Jane Rogers, our Chief Officer for Health, Social Care and Health, and very grateful to have Jane here as well. Could we home in on the what will we do differently? Because there's quite a lot, within what you said there, Councillor Bond. I'm just trying to get quite specific about this. So, Councillor Bond, yeah.
So it's really, we have commitment to do the next layer down, as it were.
Yeah.
So this was a top level. So really, how it impacted the staff and the council itself, along with, as you said, what will be done differently at that level.
Great. Thank you, Councillor Bond. I was just going to pick that point up. So well made again. So, but if I could ask you to home in on those particular points, please, because I think otherwise it can be a bit general. So thank you. Who wants to pick that up, Dave?
Yeah, if I could make a few comments. Obviously, yeah, it is about the public protection response. That's my responsibility. So take your points, Councillor Bond. I know Matt Phillips was very active in terms of work from home. There were huddles and all sorts of things for those people working from home. It's out of my bag, but maybe that needs to be followed up with HR colleagues. But as a member of staff, taking myself outside of the pandemic, perhaps, I think systems were set up quite quickly in terms of working from home, etc., because we couldn't obviously travel in. Obviously, some staff have got to go in, haven't they, if you're a social care worker? So I think it varied significantly, and a lot of staff weren't working, their leisure staff, etc., isn't it? I think it was difficult to transfer some of the wider types of activity across. But obviously refuse collectors, etc., were out and about doing their job on the highways and people out in the open air. So I think it's a very mixed bag, but I don't know who's best to probably go to follow that up. I'm just looking at my colleague as Chief Officer. I'm going to hand over to Jane on that, just on the staff side. Thanks.
I think that's called a hot potato, Jane, but I think this also recognises that there's an expression from Councillor Bond that a number of us, we discussed prior to the meeting, the importance of having some follow-up to this report that might come out of this. And I think what you've also indicated, Councillor Bond, is that next level down, understanding under the surface of the organisation just what the impacts were on different groups within the organisation. So perhaps you could give some comment on that.
I'll try to give some comment. I think my main comment would be that, clearly the report that my colleagues have presented have been very much focused on the environmental health response to trace, track and protect and the interaction with partners. But I understand the points that you're making, Councillor Bond, in that, beyond that, there was the whole council was impacted one way or the other, and I think that's, in lots of different ways. I don't mean to trivialise it. In fact, in a whole manner of different ways, people were doing different jobs, different systems were set up, different priorities were put forward. Everybody, every single person in the council who works for the council, and of course the public, were impacted. But we just haven't covered that in this report, and for me to try and sort of summarise that in a few sentences here would be quite challenging. I think, what you've given back to us is to what extent can the council do a whole council report into the impact of COVID? And I'm not sure whether I can really say yes or no to that, because it's way beyond my directorate too, and perhaps it's something that would need to be discussed with Paul, the CEO.
Jane, that sounds like a sensible approach, and it might be coming out of this meeting. There will be a few questions of this nature that would be perhaps useful to consider in terms of the follow-up response. It's about not only during the pandemic, I think, but also what residual impacts there have been on the council and on staff groups. For example, working from home has become something that is built into the way that we operate. If we had a different pandemic coming down the line, would that actually help or hinder our ability to be able to deal with it as we address it? So there are some residual impacts as well as during the crisis itself. Councillor Bond, yes, very briefly, and then we need to move on to others who've got questions.
Sorry, I beg your pardon, Chair. So when we discussed this, we had assurance that teams would do their own review. So it only needs to be a team level, just do their own review, their learning, that then builds back into the learning for the organisation. Thank you.
Thank you, Councillor Bond. Yeah, and I think that's very much what Jane was pointing at, that there is any one directorate is only going to have a view of that directorate and the deep view, but we need the view of the whole organisation. So the question's really well put, and perhaps if I could ask just colleagues to make a note of one or two of these key issues as we get through here, it would be perhaps informative for follow-ups that we might be looking for on this. Yeah, and Councillor Griffiths, I noted Councillor Bond asked about any commitment to some further work, review plans for preparation ahead. Maybe you have a comment to make on that.
As I understand, listening to Councillor Bond, a request for a further report. The report you have before you, I think, has a focus on the control of communicable disease, which is clearly at the core of our response to COVID and then any equivalent episode in the future. What Councillor Bond is saying is that in addition to that, every part of the organisation, be it our school system, be it our care system, our whole leisure activities. My personal portfolio at the moment includes our relationship with businesses, the way in which the authority reshaped town centres, tried to successfully supported business through that period, activities occurring in each and every part of the organisation. I think the suggestion is that we should try and capture some part of that very widespread activity. If there's a nervousness in my voice, it relates to the fact that whilst that is important, I wouldn't want it to become an industry in itself. That's a huge endeavour to try and capture all that. And it mustn't be too backward-looking. It would need to be a forward-looking exercise in order to be worthwhile. So that there's a nervousness in my voice because I don't want to devote too much resource to this, but I can understand the rationale behind the request, and it's a matter of managing it well, I think.
Thank you, Councillor Griffiths. I think we would absolutely recognise that we don't want to turn this into a backward-looking industry. There is a pandemic inquiry, but it's very much about saying from within that experience what essential learning can we put to planning use, which might be built into protocols, it might be built into the plans that would be in place ready for whatever else might hit us whenever that might hit, so that we're simply better prepared if that's possible. So it's definitely not, I think, about a description of everything that happened, because frankly that's not really going to help us too much, but very much the latter aspects of that. And again, I think that's something that we might want to just follow up on beyond the meeting to clearly be as clear and specific as we can about that. I'm going to move on to Councillor Howells, who's unfortunately had to leave the meeting for reasons which are unavoidable, and he has asked if we could possibly just make a couple of points on his behalf, which I'll deem to do now. He's asking the question regarding elected members and cabinet members' involvement, which is about really just expanding slightly on what that involvement was, and is there any learning that could come out of that where it could be done better? And for any resident watching, I think one of the key aspects of this is that in a national crisis that is deemed to be a national emergency, decision-making transferred from the democratic approach taken by councils in terms of their cabinet and council meetings into essential decisions being made by chief officers and the chief executive, and that happens across the country. So how did we manage that change and the ability to be able to ensure that cabinet members, the council leader, and all members were properly informed and felt that they were able to feed into this? I think that's really at the heart of Councillor Marion's question, and how that would work in terms of a recovery, post-COVID recovery plan. He also wanted to extend his thanks to officers, staff and councillors for keeping Monmouthshire safe during this period. So can I ask, I don't know, again, who amongst the officers here would want to pick up that point about the relationship with members and cabinet members in that period of time? David, did you want to give that one a shot?
Yeah, thanks, Chair. Valid questions. Governance, really, isn't it? So clearly it's quite prescribed in terms of what we're asked to do in terms of some of the stuff I mentioned earlier, standard operating procedures, etc. However, I think our comms were very good, and it's not just comms to staff, that went to all members as well. So every time, and Paul Matthews was very engaged, as was Matt Phillips, who's the head of legal and HR services at that time. So I think the communications in terms of what was happening was very good. Perhaps picking up the point in terms of governance and briefing staff in sort of like in this sort of forum, I think it was a bit hands to pump, so possibly that would be a learning point, is to come back to scrutiny and say this is where we're up to. But it certainly wasn't a lack of information going out there. I mentioned the 7-day analysis we sent, and that was looked at by very many people, including members, and we got those questions direct from members. But in terms of structure, I think answering the question, probably something we could improve upon, I think, because it was very much hands to pumps, including myself. That probably deflected us from official reports, but that's not to say that the communications were excellent. I'm sure our colleagues in comms would tell us that we produced infographics, position statements as to where we were. SLT were fully informed, so I would attend SLT to say these are the case numbers, etc. So that bit certainly happened, but certainly I'd pick up the point in terms of formality that we could have perhaps done a bit of scrutiny around that, but during that 2-year period would have been helpful. And looking forward, Chair, I think certainly a lesson learned, isn't it, as to how do we keep... Because I think the other issue is, because it was literally phone calls and members asking about a particular situation in their ward, which is fair enough. I think if you do it more collectively, that probably saves time for the front line. They're really pressurised in terms of dealing with a serious pandemic.
That's helpful, and one of the key aspects of the learning coming out of what you've just said, David, is that establishing that as the protocol, so that councillors, cabinet members, they're not surprised by what's happening, and they're at a very early stage given an understanding of how the relationship would work, it would seem like that would be a very helpful thing, because otherwise there can be this sense of sudden distancing from what's going on and actually not knowing enough about what's going on. So if you cover that with, as you mentioned, an awful lot of information, sometimes that's too much information, and it becomes important to distill it down to what is really important. So that sounds like something that could feed into a protocol that could be ready. And if you bear in mind that there are lots of new members in this council, they won't have had that experience of the pandemic to understand what's going on. So, these things, I think, are really essential learning. Thank you. Sorry, Councillor Griffiths, yeah.
Thanks. As I heard the question from Councillor Howells, there was I think, an important query as to whether in the sort of heat of the operational task which professionals at all levels of government were engaged in, did the elected members, cabinet members, somehow get marginalised? I'd actually like to offer an experience of reassurance there. I explained earlier that I would listen to conversations between Welsh Government ministers and 22 local authority leaders probably twice a week on average, including the then leader of this council, Councillor Peter Fox. The ability of those accountable democratic leaders for their local areas to articulate the circumstances of their local area and communicate that to other parts of the system, I found almost universally commendable and reassuring. And I did not get the feeling that somehow that democratic leadership had been marginalised by the process.
Thank you, Councillor Griffiths. I think one of the interesting aspects of this is that as the pandemic moved through the weeks and then months, I think some of that relationship became tested. So the importance of making ongoing decisions about what was good for the future of Monmouthshire, or necessary emergency works to be done, be it highways or be it flooding or anything else. Those kind of issues, which were non-pandemic but affected by the pandemic, in some cases I think began to test some of the relationships and some of the decision making. So some of this I think is about, in the early period, one thing might have occurred. By the time we moved through 3, 4, 5, 6 months, it may have changed a bit. And again, it would be interesting to understand if that were the case and how the protocols might be shaped around that, so that people could be very quickly given an understanding of what this would be like and how it would operate were it to, God forbid, happen again. I note, just before moving on to Councillor Murphy's question, Councillor Bond is just reminding us that she sent through a quick tool last year which was about bringing the learning out of the organisation and for us to be able to pull together. And it's a tool to be used by teams, which could be collatable for the whole. And I just make mention of that again as Councillor Bond. Thank you for putting that into the chat. And it would be good if you could possibly look back on that. It might be a ready-made tool that would be of excellent use and easy use to be able to bring this forward. Jane, I know that you have to leave in a couple of minutes. Before you need to do that, is there anything that you've got an urgency to say before that you leave, that in terms of the learning coming out of this from the perspective of social care and health in the community that we might benefit from?
I think it would be difficult to sum it up, in all fairness. I think the issue that you've just been discussing, committee, around sightedness of the extent to which operating procedures within different parts of the Directorate had to change might be a really useful thing to just think further about, because all our operations changed, so that the way that we conducted our safeguarding inquiries, for example, the level of visits that we did out to vulnerable families, everything changed. And actually reflecting back, whilst we were assured ourselves that we were doing what we needed to do, both to remain within the instructions that were handed down to us from Welsh Government about transmission and the management of COVID, we had to balance that with then ensuring that our safeguarding arrangements were in place. And that by way of example, you could take right across the Directorate. We were on a balancing act the whole time. And our reference points during that were our regional partners, were the regional groups that were stood up, rather than perhaps back into, necessarily to the detail into more of a governance structure within the council. Saying that, as we've already been discussing, it was all hands to the pump, and we were working to a very, very in very challenging times with a number of different priorities, the first of which was preserving life. So it's different times, but really worth a look back on those sorts of issues.
One of the things, Jane, that we'll probably pick up after you've necessarily had to leave the meeting is whether or not there is, in the experience of how the communities and many people in the communities came together to support vulnerable people, if there is more that we could do in that connection outside of a pandemic, there would actually be a tremendous positive for the county and for our communities in supporting people who are vulnerable within the communities on a regular basis. And whether we've captured that sufficiently or seen it as simply something that happened in a period of time and it's gone, or is there more that we could do to say, engage in a conversation with communities to say, well, thank goodness we don't have a pandemic every day, but we do have driving needs every day for many vulnerable people. So I think that's a question we'll probably be coming to after you've gone. If I just pop that down there before you leave. I'm going to move the questions now to Councillor Murphy, and thank you.
Yeah, thank you, Chair. And Councillor Griffiths was interested in the Cabinet perspective from that period, and perhaps Councillor Pavia will want to add a bit to that from his point of view. Peter Davis and I had weekly briefing sessions that were actually set in stone. Nothing would get in the way of them. But I can honestly say there wasn't a day, including Saturdays and Sundays, that went by without some sort of contact, although we did have longer formal contact on a weekly basis. An awful lot of information was exchanged. Officers took over, yes, of course they did, because that's how it works. But officers took over very much with a connection to the administration. I never felt at any stage that I didn't know what was going on. My opinion was asked for, and if there was something that needed exploring, we would spend as long as it was necessary to explore it. So, I was certainly happy from that point of view. I was very impressed by the way that all the various agencies linked together. Clearly there was a blueprint, and that blueprint will be expanded on now and updated, I'm sure. But there was an incredible amount of synergy between the way everybody was working. Everybody sort of stepped up. I think you made a point earlier on, Chair, about adrenaline. Yes, it was certainly adrenaline that was keeping everybody going. I'm getting nods from officers in the room here. There is no doubt about that. Where it broke down, I think the public. Initially, everybody did as they were told. We were all told don't go to the pub, stay at home. The weather was lovely, so we all sat on the patio. It was great. Then frustrations about the aisles closed in supermarkets. I know they've been able to go one way round. As officers know, my wife became part of the track and trace team right towards the end. She wasn't on it long, but long enough to get the frustrations of the people when she was talking to people. She was told in no uncertain terms where to go on many occasions. I'm sure she wasn't on her own there. How did it affect other departments? I'd like to see a new manual, if you like, as to. I agree with Councillor Griffiths. We don't want to spend an inordinate amount of time on it, but seeing how we would have done things differently, despite the fact that I think it did go very well, would be good. Yes, internal audit disappeared, modern life disappeared. We furloughed as few people as we possibly could, and we used them wherever we could. So I think that was a very important part of the strategy. And I think one of the most important things that was done was the Kutch, where everybody could come together online and share their frustrations, their worries, be informed about what was going on. I think as a way of communicating with the staff and keeping everybody together, I think that was probably one of the best things that was done. Absolutely fantastic. So yeah, we do need to see how we're going to progress with the lessons learned. I absolutely certain, in fact you can see it, that an awful lot of that's embedded anyway. The way that the SRS stepped up, suddenly they went from the odd online meeting to just about everything being online. Something like 20,000 discussions a day, I think, was one of the figures I saw at the time. That's transformed the way that this and other authorities operate. Town and community councils never used to have online meetings or hybrid meetings. They all do now. The whole way that business is done in local authorities and with the third sector has been transformed. So there's been an awful lot that has been learned here. But did we feel cut out by officers taking over? No.
Councillor Murphy, that's really a tremendous insight into the direct experience of being a cabinet member for finance and resources during the pandemic. It's very, very interesting to hear. If I could just follow up for officers and pick out a couple of the points that you've made that might really be informative. If there has been, as Councillor Murphy's indicated, and I personally share, a breakdown of some description in general public trust for whatever might be central government or Welsh government, but it's hard to imagine there could be Welsh government enforcement without central government, of enforced social conditions, new rules applying to how people go about their day-to-day business. If there has been a breakdown of trust in accepting that, and your commentary is about that gradually deteriorated, Councillor Murphy, that certainly rings true from my experience, then what role is there for the local authority, the council, to actually play in reinforcing those points, in supporting those points? So that local people might feel that there is a major organisation that they can trust, and it's not all on the national government. And that might well be something that we can pull out of this that could be useful for officers. Councillor Murphy, were you looking to come in on that again? Are you?
Yeah, it was just the point about the public. I think we have to accept as an organisation and tailor the way we do things accordingly. The public, as I said earlier on, the public did as they were told initially, and then didn't. There was those who absolutely did and were afraid to go out of the door. There was those who didn't do anything, and they said, well, you know, sod you then, I'm just going to get on with it. But all the people in the middle did their own version of it. And I think that's something that needs to be borne in mind. How do we coerce people into more cooperation than we actually got? Because there was a bit in the middle, I know, where you know, if you could have a gathering of 2 people, well, you could add a nought to that, couldn't you? Because it didn't really matter very much, and that was definitely happening.
Yeah, and it's just this very point that you've made, that if there has been a deterioration of some description in the authority of national government to impose new approaches, then what role is there for local authority, the council, to actually say, well, are we a trusted organisation? I hope that we are. That local residents would say, well, you know, what are they saying? So that we actually can express a view that people feel confident in. You know, again, that's something I think would be very useful to pick out of Councillor Murphy's points in terms of forward planning. You mentioned another couple of points, Councillor Murphy, I think, again, worth just emphasising. So the meetings that took place online, and there were so many of them, in a world where we are now very habituated to online meetings, but also recording many of them, what would the protocols be around decision-making at those meetings and the recording of decision-making? Because, again, that is something that is really important, and are the key meetings adequately covered by good records of decision-making? I'm not suggesting they weren't, but that seems to me a protocol that is absolutely essential. And in that regard, would we use, for example, recordings as a very straightforward, easy way of ensuring transparency, but good records being kept, so we don't, again, create an industry of, you know, record keeping, writing things down, but using technology to advantage, and that might be something that is worth picking up on as well in terms of protocols.
Because it has to be remembered that for a long time there weren't any meetings. There was an awful lot of discussions, but there weren't any meetings. Scrutiny meetings didn't take place. Council meetings didn't take place.
No, but the
formal, as we understand it now, decisions weren't taken. It was a long time before that came in.
And that's really my point.
But
so
I take your point.
The meetings that took place of those who were chief officers, chief executive, who were making decisions in that period of time, were records. Were the protocols around records for decision making where they need to be, and whether or not actual use of recordings now would be a good way of ensuring that in the future? Again, that's just it's just to really amplify the point you've made. I think it's very
I'm sure
very useful.
Dave can chip in there, I'm sure.
Yeah, Dave.
Yeah, I think Councillor Murphy makes some valid points in terms of that link to the councillors, but certainly in terms of officer decision making, you made that point as well. It was put upon us as the officers responsible for dealing with it. That was very much recorded, Chair. I chaired the Monmouthshire IMT that met weekly. Always in, not that the public inquiry at the back of your minds was at the fore, but those were recorded. It's in Appendix 2 or 3. We followed a criteria of SBARS, which is situation, background, assessment and recommendations. That was recorded every week with all those things I mentioned earlier, to have an epidemiological report. The 7-day analysis of all the cases, so that was recorded with recommendations. So those recommendations were quite important. So if, for example, USK was an issue, that would be reported up, that we've got a cluster, and that would be duly reported. So we're confident if we're ever asked to dig out everything we've done for the last 2 years during the pandemic, we can readily get hold of that. But I absolutely take your point, Chair. I think now we've moved on to online meetings. This was done in a spirit of openness with our colleagues in PHW and Naran Bevan, but certainly all the Monmouthshire IMTs, I'm going to say that because I chaired it, were covered. I know that Alan Withers was part of the multidisciplinary team for care homes. So similarly, that was all recorded as well. But in terms of modernisation, I think certainly that could be recorded going forward. And then obviously that's the local level, and then that went to a Gwent IMT, so that's the incident management team. You've got SCGs and all this other stuff, so I think that's all documented. So where things did need to be escalated, it wasn't a chat in the corridor by any stretch. It was certainly documented, and that was formally reported back to whoever needed to hear that, be it Welsh Government or Public Health Wales, etc. So systems were in place to record everything that was being decided. You mentioned the LRF earlier, so that was certainly covered as well. Do you want to add to that, Louise?
Yeah, we also had masters meetings sort of every week or 2 weeks when restrictions were made, and I think they were minuted also. And we were kept up to date. I mean, without Teams, we couldn't have done TTP in terms of training and informing staff. So Teams was definitely well used and implemented very, very quickly by Monmouthshire, almost immediately. And meeting with our local government colleagues regularly, we would come out, rather than minutes, sometimes we would come out with actions, because we all had to have actions of what we were doing in terms of communications with care homes, businesses, or different business types. Also, decisions about setting up mobile testing, that was minuted and decisions were made regarding that. So we had a few instances where we had local testing to individuals, but we also had testing centres, but that was done along with the emergency team as well, emergency planning. So yeah, technology definitely helped us implement and record actions. And I think any actions we took in terms of the population of Monmouthshire were documented.
That's very reassuring, and it's really important that we see that, we hear that, and the experience seems extremely reassuring about that. But the other part of this is exactly what Councillor Griffiths referred to in his opening remarks, which is very much about looking back, but actually turning that into looking forward. So to what extent do any of those key experiences, should they guide us in terms of what we might be wise to do now in preparation for what might be down the line? So you mentioned Teams, for example, and I'm sure we probably all gained a new familiarity with Zoom and Teams as we came out of February and into March in 2020. It's certainly, I think, the experience of a lot of community groups and also those in the third sector, that they were not all equipped and set up with Teams, let alone Zoom. And if Teams and or Zoom become the standard protocol around communications, then it would again potentially be a protocol that might be really useful to ensure third sector community groups, key community groups, they are ready for that, as opposed to floundering around saying, well, nobody told us. So those very things can be put to great use. So thank you, Louise. Thank you, Dave. Just not to lose the point again that Councillor Murphy mentioned, I thought it was very interesting that you mentioned that the coach was perhaps the most useful thing. Now that's the kind of thing that I suspect it never appears in a protocol, and actually because it's more of an informal rather than a formal gathering, but without it there's a lot of understanding and support and awareness lost. So something that is informal but incredibly important, such as, well, it might be uniquely the coach, is perhaps something to pull out of Councillor Murphy's comments there, again in preparation for whatever might be down the line. That came through very strongly. Thank you for that. I'm going to move on to Councillor Buckler, and I think you have your hand up, and thank you for your patience.
Thank you, Chair. Actually, looking at the timeline was unbelievably sobering, bearing in mind that we had 2 years of the pandemic management, through the council, working with Welsh Government. It's no wonder that our country is still suffering the effects of what happened in those 2 years, that businesses, particularly hospitality businesses, are still crippled by it. And you still see them closing now. And, you know, the enormous cost to our country, which we're having to pay back now. Would you say that we should engage more with local businesses in Monmouthshire if such a thing happens again, as we are told that, you know, there is going to be another pandemic? You know, we should factor that in, because the devastating effects of loss of jobs locally is very pertinent, and therefore, bearing in mind that the UK government sort of released funds for the Welsh government, which we got as a council, you know, was it difficult that England and Wales were sort of, you know, difficult, you know, that they seem to have a difficult working relationship, and sort of I've got a couple of sort of, you know, things I'd like you to answer. So the regional care home multidisciplinary team in the care homes, do you have a view on whether you would have lobbied for different restrictions? It must have been incredibly difficult for residents of care homes not to be able to see their families, and, you know, did it do more harming than good in some circumstances? And what effect did the isolating measures have on care leavers, those living alone at the age of 16 to 17? You know, there must have been moments where they felt completely on their own. You know, what would you have done differently? Really looking at what we can do for the next time. The regional oversight group and the Gwent incident management team are the things that you would like to see done differently. And you know, do you feel that complying with the regulations as they moved so quickly, was it difficult, and were there things that you could see would be a good thing to put in place? Thank you.
Thank you, Councillor Buckler. I'm going to say that we won't move into national issues in terms of Wales and England. It takes us down an extremely large rabbit hole, in fact, probably a warren of rabbit holes. So it would be good, I think, if we focus on the questions relating from Councillor Buckler to the regional relationships and the care leavers and the challenges of complying with what, as Councillor Buckler says, weren't simply one set of instructions, but an emerging and evolving set of instructions. The difficulties there. Can I ask you to focus on those, please?
Yeah. Thank you, Chair, and thank you, Councillor Butler. Valid questions. I think we had an excellent liaison with local businesses. So we put on training for licensed trade. Lindo Gorman was here, licensing manager. Lots of questions about, social distancing. They had to shut at 6 o'clock when it's 10 o'clock. It was quite a movable feast, wasn't it? And that's just the pub trade. So we did specifically be proactive with those particular groups to put on training, which they could engage with, be it on Teams, etc. Payment license is a big thing to remember. So we liaised with highways to ensure that they could comply with that. Use of outdoor spaces or set up takeaways. So again, to ensure that that was a community facility they could use. Then certainly we did our very best to engage with those businesses because we got relationships with them anyway. So environmental health licensing training standards will know these folk, so they'll help them as best they can regarding that sort of, it's like a bespoke service to those local businesses. So a lot of them is proactively, Pub Watch, etc. You could get them together to tell them once rather than 16 times. So we used our resources as best we could to engage with them clearly. I think the second part, Chair, was regional care and care homes. I think I might bring in Al Thomas, who's part of the MDP. And then the third bit, I think, was about 16, 17-year-olds. I think that would be for Louise, if that's okay. Thank you.
Thank you. And
Thank you. Yeah, I think it's going on from the point Dave made. It was important to realise that we had a relationship with these people already. My team all have been involved with food safety and health and safety with those organisations for years, and so they knew us well. So we had the communication was fairly straightforward for us. Not just the controls changing on a regular basis for us and us having to get up to speed on them quickly was difficult. but also the communication with those people was two things really. Was how did we enforce that? I mean, in enforcement, we're not really about enforcement in what we do. We have enforcement powers, but we far prefer to educate and encourage people to do the right thing, and that's always been our approach from our enforcement policy. Going on to the point you made about care homes as well, that was particularly difficult because the rules relating to visitors and visitors pods and one of the things that we talked a lot about was in larger care homes was zoning of those care homes, so that the controls that we would put in place would have less of an impact. For example, I won't name any homes, but some of them have different units, so then where we could, we'd delve a bit deeper into the situations in these homes where we could zone and apply the restrictions to one of those areas rather than to the whole home to make it easier for visitors to carry on in other places and lessen the impact on the welfare of those people in those institutions. So it all happened very, very quickly, as we've mentioned a few times, and we were expected to be up to speed on these changes to the restrictions very, very quickly, often on a Friday afternoon, and we'd have the phones ringing all weekend, ready for Monday morning. How was it going to work for us on the Monday morning? And we were meant to be the experts on that very, very quickly. So it was a very challenging time. Like Louise said, the multidisciplinary team was a weekly meeting on a Friday afternoon where we would round up what the outbreaks were occurring, the incidents that were occurring in our homes. That was invaluable, really, so that everybody could input what their experience had been during that week. There'd be infection control teams on it, there'd be commissioning on it. I'd be on it from an environmental health point of view, where we'd be involved with setting up testing of homes, testing of these zones that I mentioned earlier, gathering the results from those testing exercises, and feeding that back then to the rest of the team to see if there's anything else that we could add. Like, for example, infection control measures. There was a team from the Public Health Wales that would go out and visit those homes to offer advice. So it was brought up to speed very, very quickly. We were glad that we had the communications and the connections with those people already through our previous work. So I think we were at an advantage from the start, really, with the connections that we had with them. Louise.
Thank you. And Lisa, do you want to add anything to
that? One thing as well, to try and prevent isolation, limit isolation, to get homes open, to get sections open. We worked really closely with the Health Board for testing, because there were times where you could test to release kind of thing, and the Health Board really helped us with our vulnerable groups on that, with care homes, care home workers. I know Alan himself had a direct line to the testing centre, and they did set up mobile testing in care homes, and they would visit the care homes for those groups that couldn't get to a testing centre, and to speed it up, rather than send it by courier, it was sent directly to the care homes. So where we could, we tried to limit the amount of time people were in isolation, especially as restrictions and isolation guidance changed. We also did that with schools, because I think if you remember early day, if one person got COVID, we would isolate the whole class for 2 weeks, and that was very disruptive in terms of education. So with our links with Will McLean and all the head teachers who came on board and trusted our guidance, we would have head teachers ringing us at 7:30 in the morning when they were aware of a case, or we would contact them with cases, and we would also let them know who needed to be isolated. So we went from isolating whole classes to isolating just those close contacts, and we developed a warn and inform. So if they were potentially not classed as a close contact but had some contact, or we would inform them, look out for symptoms. If you've got any symptoms, go go and get tested. So where we could, we tried to limit the amount of school children that were off, and that was something Monmouthshire did before all the other local authorities. We kind of led the way, and I think that was down to the relationship and the meetings that we had, one with Paul Matthews, and with Will McLean and all the head teachers working alongside us. And as I said, we would contact them directly with cases in a class or in a school, so they knew what children were off with COVID and those that possibly close contacts. We worked really well, so communication was key, but also testing and our system of warn and inform. So that reassured parents, teachers and head teachers, because we did have head teachers with teachers that were worried about coming in if they were close contact, and having that direct link with environmental health and TTP really worked. I mean, it was a full-time job with schools because they were our biggest organisation at times, you know, some of the comprehensives in the primary schools. But I think that trust, both sides worked, and I said the warn and inform letters that were sent out, but we did start off obviously isolating whole groups, and then we would reduce it in line. You know, we weren't being risky by doing that. We were getting the guidance of IMTs with health professionals being there, so Public Health Wales knew the actions we were taking and the approach we were taking with schools, and they approved of it. So I think that really helped reduce isolation. We did also work with the partnership team within the council who had a social worker, so anybody that we would track and trace that we deemed as vulnerable or needed extra shopping or food deliveries or possibly needed some further counselling or anything like that, we worked very closely with the social worker and their team. And that was really good. And in fact, some of our track and trace team did actually do shopping for people that they did trace, because they realised they were vulnerable and, you know, concerned, you know, that they couldn't wait an extra day to get some supplies. And we did have officers deliver sort of food parcels and medicine. And we did deliver to some of our care homes alongside with other partners within the council, PPE and all sorts of protective equipment and hand gel. Where we could, we worked alongside with our facilities department to help with that. So there was a lot of trying to get businesses and people and leavers and school children to run as they could. So there was a lot of help and guidance given, and sort of Monmouthshire did do quite bespoke tracing to enable that people could either return to work or school as quickly as they could within the guidelines and restrictions.
Louise, thank you, and it's a really powerful account of just what was done. Really appreciate that, and emphasises just the immense amount of detailed work that went on. If I could just pull out of what you've just said, you know, what you've been extremely clear about in your commentary just is how important the relationships are, and that how much trust is invested in the two partners or three or multiple partners through that relationship. And it brings back that issue of, if any national government has any difficulty about imposing what is seen to be in the interests of individuals and society, an awful lot more might fall on the shoulders of the local authority, given the investment in those relationships by time and just the nature of people knowing each other, that might be extremely influential in future pandemic, which would potentially be quite different from the experience that we've had. Again, just pulling something out, you know, and coming out also from Councillor Buckler's questions about businesses and what we did, but what more we can do. One of the clear public health and indeed medical science conclusions from very early on in the pandemic, but certainly coming out of it, that might address this question of businesses, but also schools, is ventilation. And there has been so much produced in terms of supporting the importance of ventilation and good ventilation as a way of countering airborne disease. that it's hardly for a local authority to prescribe to businesses what they must do, but it's certainly advice that could be given if there are opportunities that they may have in terms of any development of their own business to ensure that for their employees to maintain employment, for customers to be able to continue to be customers, ventilation might be an absolute key aspect of that. And again, allying that to your earlier points really about the trust that we may have that others don't have, that might be worthwhile thinking about what sort of advice we might give. And in terms of our schools, what is it that we are doing or that we should do within the bounds of financial limitations to develop better ventilation? Because it does seem to be key, and there are other countries that are majoring in this, and again, might be something coming out of what you've just said that would be about not looking backwards but looking forwards that could be of great use. So, thanks for that. If I could come back to Councillor Buckler's questions about care leavers particularly, and just how challenging that has been, but what more we might be able to do looking forward in supporting those young people who are in that stage of their lives that they're leaving care at the time that a pandemic strikes. Is there anything you'd want to add to what you've already said, Dave, Louise, other colleagues? Okay.
I don't think in terms of if they were vulnerable, we would have highlighted that and had the support given. We did have a sort of a system where we could, raise any concerns, working alongside with social care. So we did have that relationship.
Which is really helpful, Louise. I'm thinking of looking ahead as opposed to looking back. What might we do more of or do differently? And I think Councillor Buckler's question might be as much about looking ahead as it is looking backwards in terms of care leavers. So, for example, this might be entirely impractical, but if communication with them is absolutely essential, would a protocol be worth setting up that each care leaver be supplied with, and I'm not saying this is practical, a laptop and a phone? If they don't already have something that is there anything that we would do differently that we weren't able to do or that we might have learned from the past? So it's just really thinking about what would we do differently and what could we learn from. Louise?
Yeah, I guess that would be discussions with the social workers and the communications with them, and the communication needs to continue, I agree, and whether that be through providing them with technology, that is something to look at and something for discussion for that team, because they're the specialists of working with those group of people. We would just highlight our concerns, and we would continue to do that with any infectious disease of anybody in the community, really.
That's a great point, Louise, but again, Dave, perhaps that's something that you could flag up in the ongoing discussion out of this meeting with Jane and colleagues, because it's all about turning the experience into great planning and how we might be able to use things differently. Councillor Buckler, were you satisfied with this responses? Where there was the issue about complying with directives as they came through. Was there anything more that we needed to ask about that?
Thank you, Chair. Yes, it's really, the point of my questions are so that we can look to do even better than we did in the 2 years of the COVID pandemic. I mean, it's exceptional what you did achieve as officers of the council, and it is, it's absolutely commendable. But obviously there is, there must have been things that weren't quite right. So it's a really good thing to reflect and, be stronger in the future. The IMT and the ROG, were there things that you'd like to see done differently? Is there anything that I'm not asking for a detailed response, but just are there concerns that you'd like to follow through on that setup? Thank you.
So, but it's quite a general question, but it's an opportunity to say if there is anything that you feel we should do that we might want to do differently or more of that might be something that you want to comment on.
Yeah, just quickly, I chaired the IMT, and I was the rep on the ROG, which is the regional group. To answer your question, I think it's very Welsh-centric. We can understand, I guess, in terms of those with the guidance, etc., was Welsh-focused. So we would flag it up through that process to say we've got to have regard to the English ones, as I said in my intro, really. We bordered 2 English authorities, and obviously not just the fact that they could be walking across the border, obviously commuting to Bristol, etc. So that communication channel could have been better at times in terms of, I think the formal route is we contact Public Health Wales to contact was Public Health England at the time, is now UK HSA, I think I got that right. And then they would contact the Forest team to contact us. We said, well, because it's speed of transmission, we need to get them more speedily, so we would contact our equivalents in the Forest Dean and Bristol, just to not go through that bureaucratic process. So that's the sort of thing on a practical level that we'd feed back to say, we just need to have better regard. And Monmouth School would be a good example, and it's full of pupils from England. So their regulations would be different because they're coming at us from the eastern side of the river. So that did cause complications, but that was fed back. So the purpose of that group was to agree working plans, these SOPs, the standard operating procedures. We would feed back to say, actually, we need to give that some more care and attention because we've been out, and from the front line, that's creating some problems. So there's a mechanism there to talk about stuff that we want to feed back to Welsh Government. So I think that worked effectively. So as I said, the Monmouthshire IMT fed into the Gwent IMT, and then that fed directly, then the chair of the Gwent IMT, my equivalent in Caerphilly, would go to the Welsh Government meetings to feed back any issues that we'd have in terms of practicalities, thinking ahead. The other thing was predictive modelling, wasn't it, in terms of I look back at a meeting in November to say Omicron might be coming our way, because we didn't know at the time it was, and certainly it did come the following month, didn't it? So these things were predictive modelling from health colleagues, which generally worked well. So at least we have a heads up to say, actually, if your staff level is X, you need to put X plus Y in, because now we've got a surge of a variant of concern that's coming through the system. So it's very practical, hands-on stuff. But yes, to answer your question, I think it did serve a purpose of being that conduit, if you like, between the front line and Welsh Government. And also, I think that example of cross borders would be an example of where we thought, hang on, we're actually dealing with event organisers that say they've done it in England, but they can't do it in Wales. And we were the ones that had those difficult conversations. It doesn't rest with colleagues in Cathays Park. We're dealing with the front line then. So some issues there, as an example.
Thank you, David. I'm going to move on with questions from Councillor Pavia.
Yeah, thanks, Chair. Thanks, officers, for presenting this morning. In the main report, it's referenced about the co-production of key documents. Now, co-production in its is very complex and is a very lengthy process to be fully realised in its purest form. So I'm keen to understand, given the time constraints at play during the pandemic, how the co-production of documents happened, or how the co-production of plans happened. Was this true co-production, or was this more collaboration and co-design with our partners? I'm keen to understand how that worked with our commissioned partners, particularly our care providers. I'm also keen to understand how beneficial or not were the preparations that were made in relation to Britain's exit from the European Union. There was a considerable amount of work and planning undertaken to prepare for a challenging or disorderly exit. And just thinking about in terms of health and social care consumables, there was a significant amount of resource stockpile within the Gwent stores. So in terms of access to key supplies, PPE, was this beneficial, or did we have the right, were the right things in the stores in terms of the planning for Brexit? And we've discussed, finally, Chair, my last question, we discussed partnership working with health professionals, other local authorities, Welsh Government, in terms of that governance and chain of command. And I'm just thinking about, I suppose, the right scaling or footprint to manage future events we've regionalised a considerable amount of our work, public sector's work. We've got the Gwent Regional Resilience Forum, Gwent Public Service Board, Regional Safeguarding Board, Regional Partnership Board, Education Achievement Service. We've got the newly established Corporate Joint Committees. Appreciate that's over a larger footprint. There's a lot of layers of governance and moving parts. You've got multiple leaders, multiple CEOs, multiple cabinet members and chief officers in this. And I've no doubt local government reorganisation will be on the table in the foreseeable future again. So would you say that a more rationalised regional model to handling such crisis would be more preferable in terms of streamlining decision making and operational planning, rather than the small LA model that we had during this pandemic?
Thanks, Councillor Pavia. And yeah, I'm sure we're not going to ask officers to comment on whether preparation would have been significantly different, better or worse had we not been in the process of Brexit. I think that would be an almost impossible thing to comment on, and I won't ask officers to do that. And I definitely will ask you, please, not to go down the Brexit rabbit hole. But if you could address the questions around the co-production, collaboration, and particularly for care providers, and whether or not the preparations were in some way made more difficult by external factors. And then the chain of command, the scale of footprint issue that Councillor Pavia has raised. Thank you.
Yeah, the first and the last, I think, first. So the co-production of documents, I think things are done at pace, Councillor Pavia, so it's probably not, I'm sure if it was looked at with detail, then that would be difficult, but certainly we would input into those standing operating procedures. I'm thinking of one about event safety, because we chair and deal with events daily. We would say, look, actually you need to actually tweak that. So I think that's what I did in terms of generality about talking about co-production, but in terms of the true purity of co-production, probably more collaborative, to pick up your first point, because things were done really rapidly and we had to sort of get things done for next Monday in real time. The partnership working bits, we're very much locals better, so we wouldn't want to do track and trace regionally. Back to, I think hopefully it's been emphasised this morning that we knew those local businesses. Alan Louise has emphasised that sort of working at local level. We knew the care homes, we know the local pubs, so I think in terms of doing it locally, that was certainly better. So we would, in terms of that footprint, but I think hopefully the report sort of emphasises we did work collaboratively, regionally and nationally, but in terms of frontline delivery, that serves best at local level, because we know the pub watch schemes, we know the local factory, we know, for example, a local factory, Polish workers, we got a Polish tracer to deal with that directly. So we knew as things moved quickly. And the other one that came to me, and other colleagues were talking, was taxi drivers struggled with hand sanitizer. So the licensing officer spoke to Environmental Health, Will spoke to the local brewery, they provide it for free, and then we distributed it to the taxi trade because they couldn't get it for love nor money because of obviously this peak of demand for that hand sanitizer. So maybe that doesn't fully answer your question, but I think the co-production was done at pace, so it wasn't pure, but certainly the intention was right to get things right before it went out. And then certainly the partnership working, I think, was exemplary personally in terms of the locality and the LRF. I'd like to think Ian Hardman would say the same if he was with us. But certainly that last point about the wider footprint, I think we demonstrated that worked better at local authority level. Thanks.
It's a challenging one, I'm sure, and just before Councillor Griffiths comes in, because there are probably operational aspects, Councillor Pavia, that need to be enacted at a local level, but perhaps your question was more about a general approach that's taken from a wider region point of view, which is not to in any way suggest that the local authorities themselves wouldn't be involved in delivering and managing the the issues on the ground. Was that what you were really getting at? That we have a more regional approach in terms of that. But whether or not you felt, David, that does exist through the LRF and through the wider engagement, is there anything you wanted to add to that?
Not really. I just, from personal level, I thought it worked well. So we did have that two-way, sort of similar to Councillor Butler's question. I think it did work two-way. So the officers here, frontline, dealing with the social care sector, it's complex in itself, schools, you name it, all workplaces, certainly complex. And I think that middle ground to the regional approach certainly worked. So we weren't... it's important, obviously, don't want to quote businesses, JD Witherspoon needs the same, they need the same information and guidance from Torvine as they do in Monmouthshire, so that certainly did work. So we're not going off half-cocked to doing perhaps what we think is best. It was done in collaboration with the Gwent region, or an Iron Bevan footprint, whatever you want to call that. So
okay,
there's a bit of a blend of. It's hard to say that was done regionally, because I think if you read the appendices, so they interconnect significantly. So Louise would be fully familiar with what's happening at regional level, because there's another group under the ROG meeting, which was the operational group that met regionally. So they ensure that they could operate to the guidance, but also to make sure that was done in a consistent manner across the county, which is obviously important.
Thank you, David. Councillor Griffiths, I think you were trying to come in.
Yeah, thanks very much. And in response to some of the comments of Councillor Pavia, I think I can always be relied on to make the case for keeping things local, wherever that is possible. I noted in the paper that early on the track and trace teams, I think, were shared with Torvine, and there was a realization that the intensity of the local relationships that you need in order to make that system work required that the teams were relocalized. And I think we can learn from that experience. My own view is that there is very often a role for regional working, but we should always test that to make sure that we're doing it because there's a need to do it, recognizing that there will be many things which are better done and better retained at a more local level. Councillor Pavia threw in a significant tangent on local government reorganisation. I've spent 30 years resisting the call for over-large local authorities, and I'll continue to do that. Thank you.
Thanks for showing some resistance this morning as well, Paul, because that's another one that we could spend a great deal of time on. Okay, great. So thank you, Councillor Pavia. Were you happy with those responses, Councillor Pavia?
Just in relation to the Brexit planning, Chair, and it's not I don't want to focus on the Brexit itself, but I know Welsh Government and UK Government, there's a significant amount of preparation that went ahead. A significant amount of stockpiling took place. And I don't know whether Jane might be in a better position to sort of respond in terms of the health and social care piece. But were any of those, any access to any of those stocks useful, particularly in the early weeks and months of the pandemic when there were issues with supply chains? Was any of that work in terms of planning beneficial? Did any of that realise itself?
Thanks, Councillor Pavia. Jane Rogers has had to leave the meeting, but Dave, is there anything very quickly that you just wanted to add to that?
Yeah, Jane would no doubt know that information, Councillor. All I know is that it came to Raglan in bulk, and then there's distributed through facilities management, so that went to the care homes to save them, obviously travelling around picking up masks and aprons, etc. I'm not aware of any issues in terms of PPE distribution, or, so I think it generally works okay. Bring in Louise, thanks.
Yeah, if we were aware of any issues brought out by our weekly meetings with care homes, we would ensure that they had supplies, and if we couldn't supply, which I don't ever remember there was an issue with supplies, was there, Alan? We would make sure that they had access to it, whether whether it be through us or the House Board, but...
No, there wasn't any, I can't recall any particular problems, but going back to a point you made earlier, Councillor Pavia, there was a regional presence on those multidisciplinary teams from the Public Health Board, and then we were the local element of that. They'd conducted MDT with each local authority in turn. So if there were any problems regionally, we'd share that. So if there were any supply issues, we could share them between us. But as David said, there was a stock in Raglan Depot, and that applied to testing kits as well. Later on, we were getting prepared there to distribute testing kits there for anybody who needed them, including care homes. But then very quickly the system was set up that they could be sent out anyway, so that wasn't actually necessary in the end. But that's how quickly things were moving at the time. So you'd do a lot of work to get something sorted out, and something else would take over. So, thank you.
It's certainly a surprise if there were no supply problems in the early period. My recollection, and having lived and worked through it, was that there were very severe supply problems in the early period, given the extraordinary volumes. Care homes, for example, going through tens of thousands of gloves, for example, disposable gloves in a month. Some of them hundreds of thousands, and similarly the availability of different kinds of supplies, from aprons, the appropriate kinds of masks, hair covers, thermometer checks, ear thermometer checks, forehead. So it's certainly a really big question, and I wouldn't want to us to glide through that, because it certainly doesn't tie in with experience that there were no supply problems. But it becomes more of an issue of how we prepare differently for anything in the future, and that, I'm sure, doesn't mean stockpiling items that have only got a shelf life of 6 months or 9 months on continuous supplies, but it might be about minimal quantities, and it might be about clarifying supply lines if they needed to be picked up. But that in itself, I think, is a huge issue. Thank you, Councillor Pavey. I'm going to move on to Councillor Strong.
Thank you, Chair. Well, it's certainly been a very instructive session. I wasn't a councillor when all this started. And although I think I was a lot better informed than the average resident, I had only the vaguest idea of the sheer extent and complexity and volume of work that was going on. Partly because, like nearly everybody else, I didn't really think about it. But I'll come back to that shortly. On the question of what we will do differently, and quite rightly a lot of emphasis has been put on that, I think, though, to put that in perspective, I suspect a lot of the answer to that will be actually not a great deal. Largely because the team, and I'm applying this particularly to the environmental health team, because that's what the report is about, the team was clearly on a very sharp learning curve. It learned a great deal, and what they were doing by the end of the pandemic was in many ways different to what they were doing at the beginning. And we've had some excellent examples: the isolation arrangements in the schools, the relocalisation of TTP, even the arrangements for hand sanitizer for taxi drivers. A lot was learned, a lot was being done bespoke. But I think, notwithstanding that, I'm sure it remained the case that a great deal of what you did was reactive. That's not a criticism in any way. You only need to go through the timeline that we were given in the report to re-remember the sheer number of new regulations and so on that were coming in, and so much of your time must have been spent dealing, with reacting to those. And I suppose we have to recognise as well that if there is another pandemic, and we all seem to be assuming there will be, but let's hope we're wrong. If there is one, it might be very different from the last one in terms of how it spread and who's affected and so on. And so it won't be easy to pick up and reapply. I think, as Churchill once said in a different context, we won't make the same mistakes again, we'll just make different ones. What what I really want to sort of ask about is about the environmental health team. There's a reference in the report to work-life balance and that sort of thing during the pandemic. I think you were being very polite there, and it's come out a bit more this morning. I suspect that what you really want to say is that some of your team were under so much pressure, they were close to breaking point, and it's in nobody's interest for that to happen. I'm amazed to hear that TTP people were going out and doing shopping and getting medicines for people they came across as they made the phone calls. Well, I say I'm amazed, but I'm not amazed because I know we have so many people who go above and beyond, and that's a fantastic example. But I don't really want those people having to go out and do the shopping and so on. The nature of the work they were doing must have been very difficult for their mental health. They should be resting and recuperating when they're not working. Yeah, and in that context, I just wonder if we had a problem, and we might even have a bigger problem next time round, that our pool of people having to deal with these things is too small. We're cutting back our staff all the time, but giving them more and more to do. And I just wonder if there's any way that we can look at ensuring that pool can be expanded quite quickly in the event of another emergency. It might not be a pandemic, it might be something else. We talked about furloughing a few people. There are other people perhaps who are doing within the council less essential things. Is it not possible to, in some way, have a pool that can be called in those events? Now, that might mean some basic training, and I accept we don't need to make a big industry of this. We don't want to pull too many people away from their work. But I'm very worried that we'll have a pool that's too small to do the work that will be needed. And whether that means that the work isn't done or whether it means that our people that are doing it suffer terribly as a result of trying to do it, it's a great worry. So I just wonder if there's any scope in thinking about that.
Thank you, Councillor Strong. And you make a great point, which is probably something that Peter, that colleagues here can comment on, David, Louise, and so on, but that we would want to see addressed as a follow-up to the meeting. It's not something we can deal with, I think, in a minute or two's response. It's such a big point. But would you like to have a go at that, Dick?
Yeah, it's a good point. Obviously, it's flagged up in the report, wasn't it, in terms of that work-life balance. You are right to flag it up, and there was a concern. It's difficult, isn't it? You're not quite sure what's going to happen next week. So it's literally the case numbers, and because of the expertise, I mean, particularly Louise and Sam, who's there. They were pinch points, weren't they? So I think the learning is how do we train up others to do that sort of middle management stuff almost, isn't it? It's not just the cases coming in. It was all the other aspects of it, all the HR, all the rest of it. That's why they had to put all these hours in. So it's a valid point. So we did have a counselling service, so we set up. So, for example, I think it's in the report as well. Some of it, obviously, there was fatalities. So a tracer dealt with that. So we immediately put training on for those individuals to deal with some difficult situations. So there was the rapid training, if you like, as and when things occurred. But the wider point in terms of the team, it's difficult because environmental health is a very reactive service. But we did have an investment. So I'm pleased to say, as a direct consequence of the COVID pandemic, we put an extra £223,000 in for 22-23 year. So that's hopefully takes a little bit of pressure off the day-to-day stuff. In terms of a pandemic response, we're going to have to think, and that's why it's in the report, to think carefully about those sky-high levels, which isn't good. And as you say, you can't have people falling down on us. HR were involved in terms of support. I don't know, Louise, you got something to add? Thanks.
Yeah, HR did offer us help and guidance with staff working, because some of the staff that we had part-time jobs and then they were doing track and trace. So they guided us on hours and how many hours they could work. And the training team within HR supported us with sort of dealing with bereavement training. So that was very beneficial. Obviously, yes, we've had some funding for further continuation of posts for next year in terms of pandemic. And as you say, the next pandemic could be completely different to what we dealt with last time. And we did use the management. So as well as the CUTCH, HR did set up a management meeting. So there we would go to that and ask if there were any staff that weren't, it sounds terrible, but weren't busy, weren't frontline. So their roles had changed because of the pandemic. And we did get staff through that way. And almost in our peak times, we would, obviously there was the time also to train them, but once trained, we could do refresher training in that 2 years. So they would come to us, it would die down, so they would go back to their post, which wasn't, which changed. And then in times of peak, we could speak to managers of departments directly in a Teams management, almost like a management CUTCH, I think it was called, where we could request. And we did get quite a few staff in that sense. Also, what we've been required to do by Welsh Government is keep a log of all the people that work for us to see if they'd be willing to come back and help us in terms of a pandemic. Interestingly, most have said yes, but there have been some people that have said no, they wouldn't be, just because of it was a very, very busy, sometimes stressful time for people. So there is systems in place to future plan for a pandemic, and this afternoon is one of those sessions.
I think really just to emphasise this though, in terms of preparation for whatever comes down the line, and hopefully it never does, it would be really good to take as an action point for coming out of this against the question that Councillor Strong's raised, the training that might go on in the emergency training now, which might allocate individuals to specific parts of the county, for example, would be training that would potentially allow us to step up at very short notice with a much, much higher level of capacity. I think that's the point underlying Councillor Strong's point. So it's not to suggest we didn't do things well, but it's to say in this, what hopefully is a very lengthy period of time before this might ever be required, but stepping up the capacity in training and potentially some allocation of people to individual areas of the county might be a way of looking at that. But perhaps take this away as something for further thought ahead of potentially. I think we'd be looking for a follow-up to this meeting in terms of the plans for the future.
Can I just sorry, Councillor Strong. Thank you very much for those replies. They're very reassuring, and I agree with what you say. And no matter how many logs we keep and how much record keeping we take, in the end also there's no substitute for what you guys are holding up here. So important that we keep these people and use what they've got up here to react quickly if and when these sort of problems emerge again. Thank you.
Knowledge, it's absolutely vital, and personal contacts and so on. Yeah, great point. If I may just finish with one question. In our family, we've had a member of the family who's had their life very, very significantly affected by long COVID, and it's a strange thing, long COVID, that we've come to realise that those who are not familiar with it barely think it exists, and those who have any severe level of it, it changes their lives, and that alone becomes a stress point. It makes me think very strongly about ME, which was regarded as non-existent some 30 years ago, including by the GP profession, because it hadn't been recognised as such, and it became something that was widely recognised. Have we any understanding in Monmouthshire through our contacts in public health and NHS colleagues, the level of numbers of people in Monmouthshire who are significantly still affected by the effects of long COVID? And if not, is that something that we could actually do something to find out more about? Because it might be that we could do something to assist them.
Yeah, thanks, Chair. Certainly we're into health board territory there, but certainly we can ask that question. I know they have clinics specifically regarding the consequence of long COVID, but they'd be able to provide you with numbers. So our colleagues in Aaron Bevan, I'm sure, could help with that inquiry.
Great. It'd be, I think, very helpful to understand that, because it's very informative to see, for example, that, well, I think it's exactly 2 years to the day that in your Appendix 3 there were 1,356 cases of the of the virus. That was then, and this is now, and right now there are a lot of people, but I don't know how many, and it sounds like you don't know how many either, in Monmouthshire, with an estimate of how many there are with ongoing problems, and there may well be something we can do to help reach out to support those people. Okay, thank you. And thank you also for the questions from members of the committee and the time taken to respond to that. And it's very clear from all the questions and from the underlying sentiments behind them that we are, as I said at the outset in my preliminary remarks, immensely appreciative of all the extraordinary work that was carried out during the pandemic by everybody involved, all our partners, all our employees and the communities and the third sector, just quite extraordinary. And it says so much about, I think, what makes Monmouthshire such a special place, and the County Council itself such a great place to find great people working to make the lives of residents better. So just reiterating what you've heard from colleagues across the committee. And moving on to, thank you, Dave, thank you, Louise, thank you, Alan, thank you, Sam. We'll move on quickly just to conclude. The Forward Work programme on item 5 sets out what that work programme is as we move through the year that will develop. As in item 6, the Cabinet and Council Work Planner. And on item 7, the minutes of the previous meeting. Are there any, thank you, are there any corrections, changes, or questions regarding the minutes? I see, Councillor Bond.
I was just going to say, for further work planning, perhaps a review of what we've asked them to do today would be on that in the future. A review of the further reviews for COVID.
Yeah, I think exactly so. And my sense of that, Councillor Bond, is less now about a review and more about future planning. We've done the review, it's been very informative. We'll get more out of the ongoing work that is done, for example, today. But this is more about, forward planning and protocols and plans to be put in place, I think. But we should bring that back to the Scrutiny Committee. And if you have a different view about that, please let's discuss that. My sense is we could review this for a very, very long time, but the value of it is to plan better looking ahead.
Okay, agree with you entirely, absolutely. My point was right at the beginning, the teams need to do their reviews so that then the top learning points can then be taken forward and then change procedures, policies, everything else. But the people on the ground, this was very much a top level. The senior people wrote this. The people who are doing the job are the people who know the best. Know quite a lot extra stuff.
Yeah, absolutely. Point taken. Councillor Pavia?
Yeah, Chair, I suppose just in relation to the COVID inquiry and the sort of first part of the report that'll be published, is going to be in stages in relation to preparedness and decision making. There'll obviously be elements there that all public sector organisations in Wales will want to reflect on and potentially, change the way that the planning and operation will look like in the future. So, I think after that report, it will be the opportunity for MCC to explore that in greater depth and potentially look to implement some of those recommendations.
I think it's really, really wise words, Councillor Pavia. We don't want to go straight out there talking about what we would plan to do differently and then find we have a different set of expectations coming down from national government. So the discussion that we would have with the officers involved would try and take that into account and actually look at that when we expect to see some conclusions arising from the inquiry, which with some luck will be later this year. It's worth noting some countries have concluded theirs quite some time ago, so it's not as if we're being extraordinarily rapid about this, but it is what it is. So, okay, we're on to really the date of the next meeting, which is the 14th of May. Thank you very much for what was a very interesting, informative meeting, and for all the questions and the responses to them. Thanks again, and look forward to the 14th of May meeting. Cheerio for now.
Well, it's not raining, maybe.